Hi, my name is Antonio Quiros. I'm a pediatric gastroenterologist and a member of the Pediatric Gastroenterology, Hepatology, and Nutrition team here at Mount Sinai Kravis Children's Hospital. I'm a clinical professor of pediatrics, and I see patients at the Mount Sinai Doctors Faculty Practice on 98th Street. Well, thank you for the opportunity to talk today to you guys. For the last 16 years, I've been offering specialty endoscopy services to children with complex intestinal, pancreatic, and biliary conditions. After I completed my pediatric gastroenterology training in Los Angeles, I proceeded to become faculty in University of California. And after several years of practicing, I realized that I had a special interest in endoscopy, and there was definitely a need for the services of care of children with very specific conditions affecting the intestines, liver, and pancreas. So I pursued a specialty training in endoscopy by doing an adult therapeutic endoscopy training at Stanford from 2004 to 2005. When you talk about endoscopy, it is important to understand that this involves use of endoscopes, which are soft tubes with TV cameras attached to the end that allows us to be able to access through the mouth and through the rectum lesions in the lumen of the intestine, in the liver, in the pancreas, abdomen, and chest. The straight luminal procedures that we perform are mostly associated with managing either tumors or narrowings or strictures or in the intestine that can be acquired or congenital, and also management of vascular lesions in the bowel. They usually present as recurrent bleeding, and also management or evaluation for complication for inflammatory bowel disease. Endoscopic ultrasound, which is another one of the procedures that we do, involves the use of endoscopes that have been modified to accommodate an ultrasound probe at the head of the scope. This allows us to, under ultrasound guidance, be able to examine the liver, the pancreas, and the areas around the intestine, sample these areas using needles and special devices that allows us to take tissue and samples in a non-invasive manner. Most of these patients are treated on an ambulatory basis and usually go home the same day the procedure is done. Pancarability endoscopy is another specialty procedure that we're able to perform regularly here at Mount Sinai Kravis Children's Hospital. The procedure involves using a special endoscope and device to be able to go through the mouth, be able to access the pancreas and the biliary tree. In order to be able to evaluate and treat diseases of the pancreas and the liver, this obviously includes the management of pancreatic trauma, reestablishing integrity of the pancreatic duct after injury, and involves managing the biliary stones, biliary strictures, complications after transplant or after surgery, and obviously evaluation of pancreatic masses. Besides the fact that these are minimally invasive procedures, and by these I mean that most patients are able to come, get the procedure, go home the same day, in many cases leading to fast diagnosis, quicker recovery, and adequate guidance and surgical care. We work very closely with our surgeons and quite often we do procedures together. In general, for our specialty, it's very important to have relationships with a broad spectrum of teams working on pediatric patients. That includes radiology, surgery, genetics, hematology, endocrinology, cardiology, and the transplant team. These relations are critical to achieve optimal outcomes. And I am very proud to say that we are able to offer these kind of services here at Kravis Children's Hospital. There are very few centers across the country that can offer these procedures to children on a regular basis. Here at Mount Sinai Kravis Children's Hospital, we are able to offer the whole spectrum of treatment choices for children with complex gastrointestinal diseases and their families in a compassionate and family-centered environment. There are no other programs in the Greater New York metropolitan area that offer the full spectrum of treatment choice for children that we can provide here at Mount Sinai Kravis Children's Hospital. This is thanks to the depth of the specialty support staff here at the hospital, and this is a testament to the commitment of Mount Sinai Health System to the care of children in the Greater New York area, and also the passion of our providers here at Kravis. Endoscopic services are available to all children, from newborns all the way to 21 years of age. Well, obviously, conditions that are eminently amenable to endoscopic management include lesions that cause gastrointestinal bleeding, intestinal polyps, tumors, evaluation of complex strictures in the esophagus, in the pancreas, in the biliary tree. And obviously, areas that are interesting to us specifically is chronic disorders of the pancreas, recurrent pancreatitis, and patients with complex esophageal disorders. I myself have participated in several national and international research efforts aimed to improve the care of children with pancreatic and biliary diseases. I am also a member of the International Society for Diseases of the Esophagus. And these are areas of specific interest to our group, and we are honored to be able to offer these services to the children of the greater New York metropolitan area. The value of partnerships cannot be overstated when dealing with children with complex gastrointestinal and liver disorders. Our pediatric liver disease and transplantation program here at Mount Sinai has a long track history of success, same as our pediatric surgery program. The main advantage of care here at Mount Sinai Kravis Children's Hospital is the presence of a broad spectrum of specialty support for the care of children with complex disorders. So the goal here is to achieve optimal results for the children in the greater New York metropolitan area. This involves having providers working in teams. This involves access to the latest technology and access to the best clinical facilities available in the area. Obviously, we're happy to take care of any patient that requires our services. We practice shared care on a regular basis. Any patient that gets sent to us, you can expect ample communication and collaborative environment in regards to care of your patients. We aim to provide the best support for patients and their families, but also for referring providers by keeping them informed, making sure copies of reports are available to you, and also access to our providers in case you have any acute questions or any issues. They can, obviously, if a physician or a family member has a question or want to reach out to me about a specific patient or issue, they can always email me directly, or they can always call at 212-241-5415. Again, this is 212-241-5415 to make an appointment to be seen in clinic.